Gentlemen of the press, I welcome you to this daily national briefing meant to update you on developments and actions undertaken by the Presidential Task Force on COVID-19. The Minister of Health and the DG, Nigeria Center for Disease Control, will update you on the operations side of our national response and give you the numbers as at today. Other ministers shall also be called upon if and when the need arises to update you on our non-pharmaceutical response. You recall that Mr. President, in his national broadcast, announced a number of restrictions, particularly in Lagos, Ogun, and Abuja. You also recall that the Presidential Task Force met with security chiefs to review the status of implementation as it affects compliance and enforcement. We have received situation reports from the Federal Road Safety Corps on interstate traffic across the country as of Tuesday, 31st March 2020. Indications are that there was a reasonable level of compliance with the presidential directive, which has led to great reduction of traffic on major highways. We have, however, received reports of challenges arising from the enforcement of the presidential directive by security agents generally and in states where governors have also imposed their own measures. As we continue to dialogue to remove the bottlenecks, I'm pleased to inform you that the Presidential Task Force has developed an implementation guide and protocols for the COVID-19 lockdown policy. I must emphasize that the exemptions mentioned in the document cover strictly the essential staff of those agencies. So when an agency is exempted, that exemption does not cover all the staff. It covers only strictly the essential staff as prescribed by those agencies. The document will be widely circulated to all the security agencies and will be discussed with the subnational entities for the purposes of building synergy in the fight against the virus. I, however, assure you that these guidelines and protocols will be published in the national dailies and broadcast on the news network for more awareness. In the course of this briefing, the Corps Marshal of the Federal Road Safety Corps is here. If you ask questions or you have received any information with regards to the traffic situation nationwide, you will refer those questions to him and he will provide appropriate answers to those questions. While the National Coordinator of the Presidential Task Force on COVID-19 will provide details on the guidelines and protocols for the lockdown. I am pleased to announce to you that Mr. President has approved the release of 70,000 metric tons of grains from the National Reserve, Strategic Reserve, for distribution to the poor, the vulnerable, and those whose livelihood will be affected by the lockdown. The first tranche of about 6,000 metric tons will go to Lagos, Ogun, and the FCT, while the remaining will go to other frontline states in the fight against COVID-19. In the continuing effort to ensure very minimal disruption of upstream oil and gas exploration and operations in Nigeria, Mr. President has approved limited operations exemption for operating companies, services, and logistic companies in the Nigeria upstream sector. They will ensure regular gas supplies to fire turbines that supply domestic electricity. He has similarly authorized the exemption of essential staff of the seaports and all other activities in the seaports of Port Harcourt and by extension, the One terminals in Port Harcourt. I shall now yield the podium to the Honorable Minister of Health to provide his daily update. I thank you for your kind attention and for your patience. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, Directors General, Heads of agencies here present. As of today, the 1st of April 2020, Nigeria has recorded 139 confirmed COVID-19 cases. 82 are in Lagos, 28 in the FCT, 8 in Oyo, 5 in Osun, 4 in Ogun, 3 in Kaduna, 2 each in Bauchi, Edo and Enugu, and 1 each in Benue, Ekiti, and Rivers States. A breakdown of the cases shows that 70% are male, while about 30% are female. The age range is mostly between 30 and 60 years, but I must be quick to stress that both men and women of all ages can be infected. 9 persons have been successfully treated and discharged from hospital, and 2 deaths are the only ones still on record from COVID-19. Both persons had serious underlying ailments, which no doubt aggravated their conditions. The Federal Ministry of Health is using the window of opportunity of the lockdown in the FCT, Lagos and Ogun to accelerate activities to detect, isolate, and treat cases. This is important because our ability to achieve the objectives in these states and the Federal Capital Territory will largely define our success in slowing the spread of infection in our country. As federal and state governments deploy human and material resources to achieve this end, a critical factor will be the cooperation of members of the public. I shall at this point remind everyone of the injunctions of His Excellency the President to all citizens to stay at home in the areas under lockdown. There is no need for travel. You are safe where you are. And by doing this, you would have contributed a lot to the efforts of government to quickly put coronavirus under control and return to our routine activities. As part of preparedness in the Abuja metropolis, we have over 1,000 bed spaces are ready for isolation and treatment of mild to moderate cases, which we can expand if need arises. We have ICU units ready in Gwagwalada and National Hospital for those who may have complications, especially those with the underlying illnesses like tuberculosis, HIV, cancer, and also the elderly. We again urge families to protect their elderly and vulnerable people by not exposing them to unnecessary social hazards. I held a teleconference earlier today with state commissioners of health, during which many issues were covered to have a better alignment between the federal and state structures. I urge them all to identify and establish isolation centers for treatment of mild and moderate cases, as well as ICU units. Lagos State has expanded its isolation wards to surge capacity, and Ogun State Governor yesterday commissioned over 200 bed capacity isolation centers. I urge other states to prioritize identification of the same within their states, beginning with our tertiary hospitals. They are ready and have been instructed to make space available. All facilities, including private facilities where isolation and treatment of coronavirus-infected persons are to be conducted, will be visited for accreditation by a team comprising experts from NCDC, Federal Teaching Hospital, Irwa, and headed by the Honorable Commissioner of Health of Lagos State. The Office of the National Security Advisor shall be invited to join, since coronavirus disease has national security implications. The team from Federal Specialist Hospital, Irwa, has arrived in Abuja, led by the CMD. We have engaged hundreds of ad hoc staff to support response and Port Health Authority staff previously stationed at the airports are to be deployed to land borders and also to key interstate roads, along with security agencies, to randomly screen and monitor the health status of those travelers who are allowed to ply the road, in order to allay the fears of local authorities, so that local roadblocks at key points in certain states will no longer be necessary. I must applaud at this time the efforts of all our health workers and other emergency responders at this critical time, especially those who go beyond the call of duty. As of now, well over 2,000 persons have been tested, with the hope of further expanding and improving diagnostic capacity across the board to shorten turnaround time and increase volume. Since this week, 2 more laboratories were added to the NCDC network of molecular laboratories for COVID-19 at University College Hospital, Ibadan, and Federal Teaching Hospital, Abakaliki, Ebonyi State, increasing our test sites to 7 to start scaling up testing capacity with hope of even further increase when human resources are mobilized for round-the-clock shift duty. A call is hereby issued for certified public health laboratory scientists and also doctors and nurses, especially in the FCT and Lagos area and Ogun area, including retirees, to indicate interest and readiness for duty by sending an email to NCDC or using the call lines. With regard to rapid diagnostic tests, none of these tests offered in the open market have been validated by the World Health Organization. The results they give are not reliable. You have to be tested in one of Nigeria's presently 7 molecular laboratories to have valid results. Vaccines against coronavirus are still a long way off, so that interventions such as social distancing and self-isolation are all we have to curb the spread of the disease. We must all continue to obey directives and measures instituted by the government, even if not convenient for us, and take them as a sacrifice for the common good. Finally, I thank our partners for their support and cooperation, and as always, encourage all citizens to continue with the following. Wash your hands frequently with soap and water, or alternatively use alcohol-based hand sanitizer. Maintain a social distance of at least 2 meters between yourself and others, especially when they are coughing or sneezing. Self-isolate if you feel ill and you have known COVID-19 symptoms or have been in company of anyone who's returned from abroad in the previous 2 weeks. Immediately call NCDC on 080097 000010 or call the emergency number 112 on your state Ministry of Health. The emergency number is being linked with the NCDC number by NCC. The emergency contact for all states are also available on the website covid19ncdc.gov.ng. Stay away from all people if you feel ill, and clean all frequently touched surfaces with alcohol-based disinfectants daily. Cough or sneeze into a tissue or a handkerchief and cover your mouth and nose with this tissue. Dispose of them in a covered bin and wash your hands. Alternatively, if you do not have any of these available, cough and sneeze into your sleeve at your elbow level. And thank you all very much for listening.
So thank you, gentlemen and ladies of the press. After that exhaustive update by the Honorable Minister of Health, I'll just add a few points and then I'll focus on one specific area like I did yesterday. Just to add to his update on the cases, in addition to the cases, some of these are individual cases that have come back, have been infected, but some of these are also parts of larger clusters. So we are investigating them. There's a ship cluster, a number of people that were on a vessel just outside of Lagos, and a number of people that were investigated and became infected as part of a group of people that came back to Nigeria together. So this is very diligent work. Every case is investigated, and sometimes through that investigation, we find out that there are a cluster of cases, we investigate them, and then the public health measures are focused on that specific scenario. But for most other cases, they are individual cases or within their families, and those are managed appropriately. So this very hard work will not be possible without some technology. So I'll focus the last few minutes on briefing you on some of the work that we're doing across various aspects using technology that you have access to some extent. So for all our surveillance and contact tracing, we're using a digital platform called SORMAS to collect information on all the cases, all the contacts. These are then displayed on dashboards at the federal level, at the state level. With those dashboards, we understand the progress of case finding every day. That dashboard informs us on where the contacts are, where the cases, which contacts are linked to what case. So it is with this information that we send out teams every morning to do the detailed investigation required. As at this morning, we are following up on 70% of the over 5,000 contacts that we have identified. Every day we are pushing that number higher, and that is one of the key purposes of the lockdown in Lagos and Abuja and the Ogun State, to enable the teams find these contacts, make sure they're well. Those that are sick, bring them into care. Those that are well, follow them up for 14 days. So this is the primary strategy at the moment. We couldn't do any of this without the technology to support the work that we're doing. So in addition to the dashboard, everybody has a handheld device that they use once they go to the individual's home or call them, they put in that information. Immediately that information is put into the handheld. It appears on the dashboard. We know whether that person has been seen on that day or not seen on that day. We monitor that in real time in our emergency operations center. The other bit I'd like to share with you, and I hope you visit because we've spent a lot of effort making this as user-friendly as possible, is the website www.covid19.ncdc.gov.ng. We know there were some problems about a week ago. This was just because of the traffic to the site. Working with some of our partners, we have now enhanced the accessibility and user-friendliness of this site, both for the computer version and for the phone version. On that site, you will find all the information you need. The cases are reported in real time. We have a geographical information system displaying the trajectory of cases as we announce them. You will find all the historical guidelines that we've released on social distancing, on self-isolation, on case definition. We try and update this as frequently as possible. So if you see any error, please let us know, but there's a team working specifically on this. all the IEC materials, information, education, and communication materials that we have shared with the states are also put up there. So if you have an organization that wants to start a campaign on any issue, pick out the material, convert it to your own use, as long as the content stays the same. You can put your logo, add whatever you want to add in terms of branding, just keep the content. For us, it's only important that the content stays specific so people know exactly what to do. We've had over 1 million views so far on this website, so people are using it. Many of just about 50-60% of viewers come from Nigeria, so there are lots of interest by Nigerians probably across the world wanting to know what we're doing in Nigeria to control this outbreak. So we also have a WhatsApp platform with information, so we're working very hard to make sure everybody is kept informed at all times, and we need you, ladies and gentlemen of the press, to help us disseminate this information. Information is power. Information needs to be gotten to the bottom of the community, and we really need you to work your magic, as you always do, to make sure Nigerians are informed, educated, and empowered. It is only by community engagement. Our people in the community are the strongest weapon we have. We need them to rise up, to take this as their own challenge. So we need you to reach them. Thank you very much for your time. I look forward to engaging with you further. Thank you.
Thank you very much. We shall now take the report from the Minister of Information and Culture.
Mr. Chairman, members of the Presidential Task Force COVID-19, gentlemen of the press, with no vaccine or drug yet for COVID-19, the only option available today for its containment is the MPI, that is the non-pharmaceutical intervention, which includes social distancing, self-isolation if exposed in any way, contact tracing, and staying at home. The Presidential Task Force is employing public advocacy via massive public enlightenment to get this information to Nigerians in all the nooks and crannies of the country and get their buy-in. With the NCDC developing content for the advocacy, the task force is doing a lot to get life-saving messages to Nigerians. Radio jingles produced by the NCDC with support from the UNCDC, USAID, and the TOR in Pidgin, Hausa, Yoruba, Igbo, and TV jingles in English are being broadcast on some radio stations in the 6 states of the Southwest, while the TV jingles are being broadcast on NTA channels and TVC. We are upscaling that to ensure that the jingles are carried by radio stations in all the states of the Federation and the FCT in as many indigenous languages as possible. Radio is one of the most powerful platforms to reach the grassroots. The task force is keenly aware of this. Hence, it has deployed the entire radio stations in the stable of Radio Nigeria to commence the broadcast of the jingles across the country. The network service of Radio Nigeria is currently running the English version of the jingle on prime time. Short messages on preventive measures were developed for broadcast as bulk SMS on the network of telecom service providers as a way of reaching out to millions of their subscribers. Efforts have been made to harmonize all the messaging going out from different sources to guard against sending out contradictory messages. Due to this synergy, all the social media handles of the State House and the Federal Ministry of Information and Culture are currently sending out similar messages. As a follow-up to the broadcast of Mr. President on COVID-19, short messages were developed from the speech, highlighting the facts about the lockdown. The messages were disseminated on the social media to further enlighten the public on why they should comply with the lockdown and what is also required of them during the lockdown. Similar messages were developed on what self-isolation means, who are to self-isolate, and procedures for self-isolation. All the messages are being disseminated via the social media. We're also tracking and refuting fake news and misinformation. Examples include the fake news that the federal government would pay $30,000 to all Nigerians with verified BVN, as well as the report on some false remedies and cures. We have also debunked a newspaper report that some 26 Americans who flew into Nigeria recently were not screened before being allowed in. Also, when a mob burned down a police station in Kusada local government area in Katsina State because the police prevented the people from congregating for the Friday prayers, as well as the massive demonstration by an Islamic group in Jos due to the ban on large gathering, we contacted the Katsina and Plateau state governments and provided them with some jingles, which are currently being aired repeatedly on the state's radio stations to further create awareness on social distancing and the need to avoid large gatherings. More volunteers are also being deployed to the call centers and are being trained to take calls and provide basic information and direction to callers. The frequently asked questions developed by the NCDC has been updated in order to assist the call center operators to provide basic information. Of course, this daily press conference of the PTF is being covered live by NTA, FRCN, TVC, and many other stations, while the print and social media are also adequately providing coverage for the press conferences. We thank all of you. The NCDC is also finalizing the template for massive grassroots and community mobilization that will take cognizance of social distancing. In other words, instead of bringing people together in one place to enlighten them, might not be better to use other means to reach them in their communities without having them congregate in one place. We will leverage on the existing network of the National Orientation Agency, UNICEF, Health Education, Environmental Health Officers, Red Cross, and Yaradua Center to commence massive community engagement using many outdoor methods. Media appearances by members of the PTF on both radio and television, members of the task force are making rounds to further keep Nigerians informed. I have personally appeared on several of such programs. The Minister of Health, the DG of the NCDC, have appeared on these programs, including NTA and FRCN, TVC channels. I also know that the DG of NCDC has been on channels and Arise, among others. And this morning, I know also that the National Coordinator was also on channels. And this will be a continuous exercise. I thank you very much.
Thank you very much, Minister of Information and Culture. We will now take the National Coordinator, Dr. Sani Ali.
Thank you. Chairman, members of the task force, security agencies, chief executives, and media, good afternoon. So before I start, I wanted to make a few clarifications. I understand there are a lot of questions with regards to testing. Who can be tested for COVID, coronavirus disease? As the DG NCDC said yesterday, there's nothing like screening for coronavirus. There are 3 indications for testing. They are all related to having symptoms. If you have symptoms of fever, cough, and shortness of breath, and have either been in contact with a person confirmed to have coronavirus infection or traveled to an area where coronavirus infection is currently an issue, then you will be tested. The 3rd criteria is if you have a severe respiratory tract infection in an area where coronavirus exists within the country, you will be tested. So I'm appealing to the general public, please. We really want to turn off the tap on inappropriate requests because it's already affecting our ability to reach those people that are most likely to have coronavirus infection, whom we need to isolate. If we are unable to reach them, this epidemic will continue. So I'm appealing to the general public to please understand with us when we tell people that there's no indication. I'll also refer people to the NCDC website. The second thing I wanted to clarify has to do with funds, particularly from the private sector. We'll be making information available on who to contact from the Presidential Task Force side. But I also want to make it clear that the Presidential Task Force has not received anything in terms of financial contributions. We have received commodities from the Jack Ma Foundation and a few others, and these are commodities that we have been distributing across the country, mostly personal protective equipment. I would like to now take you through the implementation guidance for the lockdown. Before I do so, I want to re-emphasize to the security agencies that there is a difference between a lockdown for election purposes and a lockdown for the purpose of controlling an epidemic. There is a need for certain groups to be allowed to move around, and I will appeal to the security agencies to please cooperate and help us to make sure that the necessary instruments are in place and people are also allowed in situations where we have made exemptions. As you are aware, the federal government has decided to impose social distancing measures and limit the spread of SARS coronavirus. In line with this, schools, organizations, and businesses in the Federal Capital Territory, Lagos, and Ogun State closed effective from the 30th of March 2020 at 2300 hours for an initial period of 2 weeks. This guidance applies to these 3 states, but it is possible that state governments may apply other measures as they deem fit. For the period of the lockdown, every person in these 2 states and the FCT will be confined to his or her place of residence unless strictly for the purpose of performing an essential service, obtaining an essential good or service, or seeking medical care. Borders linking the 2 states and FCT to the rest of the country will be shut during the period of the lockdown, except for the transport of persons on essential duty, transport of food, fuel, manufactured goods, or donated relief items. Security agencies are please invited to note this. Mass gatherings is prohibited except for funeral services as guided by infection control and prevention regulations, for which social distancing rules still apply and crowds are limited to not more than 20 persons. Movement between and within the 2 affected states and FCT is restricted, except for workers involved in the delivery of authorized essential services, duties, food, and goods. Retail shops and malls must be closed, except where essential goods are being sold. Shops and malls that are open for this reason must enforce social distancing and hygiene measures in line with issued guidelines. Any business or organizations providing essential goods and services must identify the staff who will perform these activities. Commuter services between cities and states, including passenger services, bus services, e-hailing services, maritime and air passenger transport, are suspended for the period of the lockdown in the affected states and FCT. However, limited transport services will be allowed for the movement of workers, services, and goods in response to COVID-19 and for the purpose of seeking medical attention or the provision of essential services. Transport services available during the lockdown, however, must implement social distancing and hygiene measures. We have provided a table with a list of essential services and businesses that are exempted. This table, together with the guidance, will be available to the media and to our website, on our websites. The services and businesses include medical, retail, food and drink, logistics and transportation, accommodation, financial institutions, government institutions and public utilities, places of worship, agriculture, manufacturing, aviation, communication, legal and security, diplomatic missions, international development partners, and honorary consulates. However, please note that there are specific exemptions for this group, and only people who are expected to be on essential duty are exempted. I would like to now let you know about the protocols for the lockdown as it relates to one, road movements. With regards to the carriage of passengers, we must ensure adequate spacing in between passengers, clean and disinfect frequently touched parts, including door and window handles, steering wheels and dashboards, and encourage passengers to perform hand hygiene frequently. For supermarkets and food stores, all owners and managers of supermarkets and food stores must strictly adhere to the following. On arrival, all staff must be screened for a high temperature. Those found to have a high body temperature above 38 will be denied entry and advised to seek immediate medical attention. Staff and customers attending to supermarket and food stores must wash their hands before entry to the store. Owners must make provision for regular hand hygiene for staff during working hours. All deliveries of supplies and products for these supermarkets and food stores must be made between the hours of 5 a.m. and 9 a.m. Porters should wash their hands before offloading products and goods. Store opening hours shall be between 10 a.m. to 4 p.m. daily for customers. At any point in time, the total number of customers inside each store must not, on average, exceed a third of the store's maximum capacity. Where necessary, store owners should assign security personnel to ensure strict compliance with these measures. From 4 p.m. onwards, all shelves, aisles, and stores are cleaned and disinfected, and by 6 p.m., all stores must close and staff conveyed back to their respective homes. Again, I will emphasize that these measures apply to the states of Lagos, Ogun, and the FCT. For pharmacies, the rules as per supermarkets apply, except that for pharmacies that run 24-hour schedules, they will be allowed to operate as usual. Markets. In order for markets to operate, state and local government authorities, as well as leaders of market associations, must take full responsibility for strict compliance with the following protocols. 1. Only shops and stores selling food and groceries shall be allowed to open to customers between the hours of 10 a.m. and 2 p.m. every other day or less frequently. These are shops and stores within markets, just to clarify. All market associations must make provision for hand washing for all sellers and buyers. At entry and exit points of the market, both sellers and buyers must wash or sanitize their hands. Each stall or shop in the market should ensure that their customers queue and are attended to serially while complying with social distancing measures and avoiding overcrowding. All shop owners and staff must arrive and set up at least 30 minutes before the market is open to customers. Each store owner is responsible for cleaning and disinfecting their premises. All markets shall strictly comply with social distancing policies, and a safe gap should be ensured between shop and stall owners and customers. With regards to banks, all banks shall comply with the guidelines, the mode, and scope of operation issued by the Central Bank and the Federal Ministry of Finance as it relates to the COVID-19 response. All banks shall make provision for hand hygiene at the entry of the premises and temperature monitoring of all staff and customers visiting their branches. Those customers and staff found to have a body temperature above 38 degrees shall be denied entry and advised to immediately seek medical attention. Banks should develop a schedule for cleaning buttons and surfaces of ATM machines. Finally, there's a list of exempted government agencies that will be published. This is partly due to the essential nature of their functions, but again, I will emphasize it applies only to staff that are on essential duty. And this is a list that's not exhaustive. Includes the Presidency, Office of the SGF, the Federal Road Safety Corps, Bureau of Public Procurement, National Agency for the Control of AIDS, and offices of all permanent secretaries, CEOs, accounting officers of all MDAs in the public service. 2, the Department of State Services. 3, the Central Bank of Nigeria. 4, the Federal Ministry of Agriculture, particularly the National Grain Reserves. 5, the Federal Ministry of Aviation and its parastatals, including the Accident Aviation Bureau, the Federal Airports Authority of Nigeria, the Nigeria Airspace Management Agency, the Nigeria Civil Aviation Authority, and the Nigeria Meteorological Agency. 6, the Federal Ministry of Communication and its parastatals, including the Nigeria Communications Commission, Galaxy Backbone, and the Nigeria Information Technology Development Agency. Federal Ministry of Environment, the Federal Ministry of Finance, Budget and National Planning, including the Nigeria Customs Services, the Nigeria Sovereign Investment Authority, and the Debt Management Office. The Federal Ministry of Health, including all the teaching hospitals and federal medical centers as it applies to these 2 states, and the FCT, the Nigeria Center for Disease Control, the Nigeria Primary Healthcare Agency, Development Agency, the National Health Insurance Scheme, and the Nigeria Institute of Medical Research. Next is the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, including its parastatals. Then the Federal Ministry of Information and Culture, including its parastatals as stated. The Federal Ministry of Interior, including parastatals as stated. The Federal Ministry of Justice, the Federal Ministry of Petroleum, the Federal Ministry of Transport, the Federal Ministry of Industry, Trade and Investment, Water Resources, the Armed Forces, and the Nigeria Police Force. This information will be made available to agencies of government, including security services for guidance, and also to the general public. Thank you very much.
Thank you, Dr. Sonia Liu. We have indications here that we have 8 questions from the floor, and we'll now take them one after the other. The ministers will take their notes and after taking the basket of questions, they will respond one after the other. The Minister of Environment is here, and he will now make a report before we take the questions.
The SGF, honorable ministers, distinguished members of PTF, press, ladies and gentlemen, good afternoon. Just an update from the Federal Minister of Environment. The last time I was here, we told you we have activated our environmental health officers in all the 774 local government. We are keeping track of what is going on down there, getting the information. These people are there for the people at the grassroots to reach out to them, and from the report we are getting people seeking information, and they are there providing that kind of information. You will see some of them in uniform like I've shown you the other day with the white and khaki. These are well-trained environmental health specialists who can advise and tell people more about sanitation, because that is part of their training. We are operating today, I can say, a system that is full of redundancy. You will hear about sanitation, disinfection. Exactly. Why? Because that is what is needed to contain the spread of this virus. Now moving on to disinfection and decontamination. Why disinfection, decontamination of facilities? This virus, as we know and we have had, can remain on surfaces, whether it's wood, plastic, metals, or handles, doorknobs. So the Environmental Ministry, in conjunction with Federal Ministry of Interior, specifically the Federal Fire Service, this afternoon have concluded training of the Federal Fire Service staff, and we have actually fired the first set of trucks. These are specialized trucks that will be used for disinfection, and they have actually started this disinfection. Today, a team of disinfectant, 4 teams, have gone out and have started decontaminating, disinfecting, starting with the Federal Fire Service itself, which I fired the first truck. These are foamy disinfection and fumigation. Some places you might see gaseous type. This is all in an effort to contain the spread of the virus. There is team 1 is currently here in this building, which will be undertaking some after this briefing. So we have 4 teams that are currently going. Team 4 is the one in charge of all the markets around. You have the Utako, Jabi, Kado, Garki, Uye, Kaura. All this will be starting tomorrow. But today, we have the Federal Ministry of Finance, Federal Ministry of Foreign Affairs, Treasury House, Radio House, Defense Headquarters, and several other establishments. This has become necessary in order to make sure we contain the spread of the virus, especially, like I said, being left on surfaces. This will go in a long way. So again, please, we need the cooperation of you, the press, to let people know, and the people who are watching at home. This is just the brief from the Federal Minister of Environment. Thank you.
Thank you very much, Minister of Environment. We will now take the questions. You already know your numbers. I will invite them one after the other, beginning with number 1.
Good afternoon, Mr. Chairman of the Task Force, Honorable Ministers, and my colleagues. My name is Emmanuel Kutara from Radio Nigeria. My first question, Minister of Health, in your speech you said we have 139 cases, but from the Twitter page of the NCDC, by 12 noon, it said 151. So I just need clarification. SGF, sir, there are information available to me that fertilizer products are not allowed to move across the country. Meanwhile, the President in his speech exempts food and its allied products from the lockdown, and the fertilizer is part of, fertilizer is part of them. This action will affect agricultural production negatively and may result in food shortages. What are you doing to check the activities of the security agents in this regard? Thank you.
Honorable Ministers, DG and CDC. My name is Amaka Ode from Arise News, and I want to start with the National Coordinator, Dr. Sani Aliu. He's a bit distracted. Okay, Dr. Sani, I'm just to follow up to what you said earlier. You did say that those who own supermarkets and even those who work at the markets, they're allowed to move around. Of course, I want to know how they'll be able to identify themselves. Is there some sort of identity that will be given to them that they can show to the security men on the road so they can go through? And also, you spoke about the markets, making sure that everyone who comes in wash their hands. We do know that we have challenges with running water because the WHO says the water that you use to wash your hand has to be running water. So for markets where those facilities are not available, would you shut those markets down, or I don't know what other alternative is available? And the Minister of Interior, well, we've heard so much, especially from the Minister of Information, Health, as well as the DG, speaking about jingles being used to, disseminate information. But one group of people that don't have access to this are prisoners. I'm sure you've heard about the riot in Kaduna State Prison yesterday, where prisoners, of course, are scared of the coronavirus and knowing fully well that our prisons are congested. So what are you doing to share the information and also the social distancing? They are humans, they are Nigerians, their life matter as well. So I need you to address that as well. And unfortunately, the Minister of Humanitarian Affairs is not here, so I'll direct this question to the Secretary to the government. Well, we have to say well done to the government for all that you've said in terms of the grains that the President have approved. And we've even heard that some monies are being given to the poorest of the poor. But one group that we haven't really taken cognizance of has to be the elderly in our society. Because if you look at our social protection program, there's no place where it talks about assistance for the senior citizens. And of course, the Senior Citizens Act that was signed in 2018, there's no implementation of that right now. And they have been identified as the most vulnerable to COVID-19. So what are we doing to address them and make sure that they are not hungry while, trying to run away from coronavirus? And the Minister of Information, well, there is a question that came in via Twitter for you. And he says, I'm going to read it out. It's from a young man whose name is Ayomide. He says, I need the Minister of Information to appeal to cable television providers, at least for this period of the lockdown, to cut down subscription fee, especially multi-choice. They have made so much money from Nigerians, and now is the time to pay back. So he wants to know if there's something the government can do while we're insisting people stay at home, at least they have something to watch. Thank you.
All right, good afternoon. My name is Terry Kumi from Channels TV. I have a few questions here. I'd like to start with the SGF. It will appear that the security agencies do not have clear-cut directives on how to handle defaulters on this lockdown order. I want to know if the federal government instructed them to probably whip defaulters, arrest, or what exactly are their directives for defaulters. I also want to know with the conditional cash transfer, we know that the Minister for Humanitarian Affairs today was distributing money in cash to the beneficiaries, beginning from Kwali. I'd like to know from you if the government looks back and says we should have done this earlier, because as it stands, markets are closed and these people would rather have food than money at this time. And then the national coordinator mentioned that no money has been received yet, but we also know that the ICPC has been warning that corrupt individuals should stay away from these monies. I'd like to know if we can get a commitment from you on how you can publicly publish the funds as they come in and how you expend them. And I have a final question for the NCDC boss. I'm sure you're aware of the conversations in the public space right now with the case of Imo and the second fatality case. In fact, you've been fingered in that. There are insinuations that you were aware of that, and you've also helped the government to cover for that so that no case will be reported in Imo State. Could you respond to that, please? Thank you.
Good afternoon. My name is Nikki Adibowale. I report for Premium Times. So I have about 4 questions to ask. The first one will go to the SGF or National Coordinator. So there was a mass departure out of Abuja and Lagos when the lockdown was announced. How is the government making sure that persons who have left these cities have not traveled along with the virus to other places? Is there a tracking mechanism for community follow-ups with the state? My second question is for NCDC boss. So you provided or the agency provided some numbers for Nigerians to call in case of emergency or COVID-19 related issues. A toll-free line, a mobile number, and one for SMS. Unfortunately, all of these numbers are not going through. Actually, I've been trying for the past 4 days. I was going to ask yesterday, but I wanted to give it one more day. About 5 minutes ago, I tried again. None of the numbers were reachable. Thirdly, okay, for the Minister of Health, sir. So how do you intend coordinating the health workers we have on ground? And for now, do we have a data of medical workers force available in the country, like accurate data of health workers in the country, sir? So lastly, for the treatment of COVID-19, is it expected that every state operates a treatment center? If yes, can Nigerians have an insight into how it will operate and facilities to be used? Thank you so much, sir. That will be it.
Good afternoon, sirs. Good afternoon, my colleagues. My question is for the Minister or the NCDC boss. Now, coordinated data sharing has become an essential tool in the ongoing fight against COVID-19. In an effort to establish effective public health strategies and protocol for containing the spread of COVID-19, do we have a mass data collection method at the moment? In this uncertain time, as the federal government exploit data-driven solution to curb a global health pandemic, are we considering how data will be handled in the aftermath of the virus? Now, this for the SGF. How is the federal government handling homeless immigrants in the country? That's if there's any. How is the federal government handling homeless immigrants? That's if we have in the country. Yes. Now, experts have suggested for alternative medicine care for COVID-19. I don't know the position of the Honorable Minister of Health. Thank you very much.
Good afternoon, the SGF and members of the Presidential Task Force team. My name is Yemi Adebayo from AIT. I just have 2 questions for the Minister of Health. First is, in the course of your text, you did say that some of the isolation centers to be used for testing of COVID-19 will be inspected in the days to come. I want to know, when is this going to take place? Then secondly, you agree with me perhaps that community health nurses, the public health nurses, as well as the public health physicians, perhaps the underemployed or unemployed, yet there are calls for more health workers to join in the fight against coronavirus. Is the government looking at this perspective in employing the services of this set of people? You know, Lagos is actually looking at this angle in terms of fighting COVID-19 in Lagos State. Thank you very much.
Good afternoon. I am Itaire Ikben from the Nigerian Television Authority. We recall that during the Ebola health crisis, when an infected person dies, the corpse is said to be as infectious, if not more infectious than when the patient was alive. Is this the case also with the coronavirus? And what is the protocol for burial? Is the body released to the family? I want the task force to clarify. Again, there appear to be, at the moment, with the cases we are experiencing, a penetration of the southwest states in the southwest geopolitical zone. So is the government considering a lockdown of more states with the cases that we are experiencing? Again, when we talk about road construction in Nigeria, it comes with a lot of known hardship for motorists, such as diversions and gridlock. The government is giving a lot of window for essential services. I don't know if the government is considering using this window for construction of some essential roads in the country. I'm just asking. And finally, with respect to home remedies, at this point in time of the coronavirus health crisis, a lot of home remedies are being bandied around. And with the lockdown, a lot of people are at home. They are talking of taking lime, taking lemon, and all manner of concoctions. I'm asking the national coordinator, what is his advice to Nigerians at this time with respect to home remedies? Thank you.
Good afternoon, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question goes to the national coordinator, Dr. Aliu. While reeling out the guidelines for the lockdown, you said the market will be open and you gave out the instructions. Who goes to the market? Is it the essential workers, or how do other people find their way to the market? Secondly, it has to do with, my observation is on the attitudes of medics. Maybe the Honorable Minister of Health could address that. I had a colleague, I have a colleague who said yesterday he was feverish or something, so he went, he was on essential duty, so he went to a health center and the person in charge asked him to go out, that he should know how to observe protocol. So I don't know if you ask them to be civil in their response also. And then security personnel too. There are several reports that they have been confrontational even to people that are on essential duty. Thank you.
Thank you very much. We've taken all the questions. Some of them are double-barreled. Some are even more than that. The questions have been directed at the Minister of Health, supported by the NCDC, the Minister of Interior, the Minister of Information, the National Coordinator, and the SGF. In this order, we will take their responses. Honorable Minister of Health.
So, good afternoon again. The very first question was to bowl us here out, for those of you who play cricket. The point is that the figures for the day are released by NCDC twice, at 11 a.m. and at 7 p.m., the figures. And my speech was prepared at about 10. So you see that it was a little bit behind. But I did know that there were 12 new cases, and in fact this is interesting for you to know that one of the vehicles intercepted trying to enter Nigeria from Benin Republic with many Nigerians on board. I think it was a bus, over 100, heading for Osun State. It is said that they were coming, I think, from Ivory Coast or Ghana, I'm not quite sure. And it is among those groups that we have 12 immediate new entrants. So those are imported cases now, which added to the 139 which I read and give you 151. So It shows the importance of importation and of border closure. Now, in this case, they are our citizens, and they are knocking on the door at the border, and they have to be let in. But if they were not our citizens, definitely you will have had a problem having to handle infected persons of other nationalities. In this case, the closure of the border is important, and we're asking and also requesting Nigerians to stay where you are, except you absolutely have to travel. Then, because the risk of travel itself exposes you to crowds, you're in a taxi or in a bus that's loaded with people, there is no distancing involved, and if you are going to travel several hours in a bus or transport medium that has so many people packed together, then you're at risk. So these people obviously the travelers put themselves at risk. So my advice is that you stay where you are and don't take the risk unless you are walking. Now, the other question is about health management and data. Yes, the Ministry of Health does have a good workforce registry and also health facility registry. So we do know exactly the kind of personnel that we have and where the shortages are. And it's only important to know that where the outbreak is happening right now is number one in Lagos, and number two in FCT, and then to a smaller extent in Oyo State and Ogun State. So therefore, the call for support and talk of workforce will be specific to those areas. So we are not necessarily mobilizing workforce in Nasarawa or Kaduna or Akwa Ibom, but the areas where you are closest to. So you are not going to have a long journey. Therefore, the mention of the workforce registry, yes, is only for academic reasons here, but it's not pertinent to where they are needed. I made my own appeal for those ones in those states to volunteer, the workers in those areas, whether doctors, nurses, medical laboratory scientists, to come out and support those particular areas, and I hope that that's where they reside. The same goes for data management. The health Ministry has a very strong and able data management system, the Health Management Information System, which is manned by a senior officer and collates data from all facilities and agencies. We are in the process of upgrading and scaling it up right now to become a lot more robust and comprehensive, and to be able to give us the data that we need for decision making. The question of isolation centers, yes, we encourage all states to have before that many states do have isolation centers for tuberculosis and certain diseases, but maybe one all-purpose isolation center. But talking of isolation centers, it's no use blaming ourselves that we don't have one, because most countries don't have, and the ones they had were easily overwhelmed. You know that there are certain European countries where patients were lying on the floor because there are no beds left. So if your health system is overwhelmed, the infection allow public health workers to zero in on those cases, to reduce the import and zero in on the cases we have. As we heard from NCDC just now, they have taken care of about 70% of the contacts, and they are going to push very hard, and I am also pushing them to go fast to make sure that they cover the remaining 30%, because those 30% are going to increase and multiply the way the nature of this disease is. so that they have covered a lot of ground. And that will yield a lot more figures, as we are seeing here, while we have time to have more stringent, pay more stringent attention to imports. So the lockdown of those states is strategic. Should the picture change and the burden in other states become very high and they become a high source of threat to other states or to other regions, I'm sure His Excellency the President will consider locking down any such area or portion of a state. It may not necessarily lock down a whole state, but it is all not necessarily along political boundaries. It is along the practical boundaries of how the disease pattern has turned out. So the decision obviously is with the head of state. We just provide the advice and information that helps him to take strategic decisions. The question of home remedies I will leave to Dr. Sani. And the fever, well, fever, we must not forget that fever is just a symptom. By itself, it's not a disease. It's a symptom of a whole panel of diseases, from the flu, the influenza infection, bacterial infection, and other viral infections and so forth. So the fever is just an indication. And we should not be so carried away with coronavirus that we forget that someone who comes with a fever can actually have malaria or something else. So we must always bear that in mind and combine that symptom with other symptoms, sore throat, and history, the travel history that give you suspicion to send such a person for that diagnosis. I think that is all that we have to answer to.
So quickly, a few answers to your questions. On the call center line, yes, I just called them after you asked the question. They're installing a new UPS system right now, so it'll be down for about an hour. But I just got the data for yesterday. They took 4,700 calls yesterday alone, out of which 36 specific incidents that required escalating were escalated. They have 29 agents working 24/7 right now. So yes, I will raise my hand and say yes, there's an interruption in service. It will stay for about an hour, but the call center is working. On the case in Imo, honestly, I can't respond to every Twitter warrior that wants to share whatever they want to share. There's no confirmed case in Imo State. The Honorable, His Excellency, the Honorable Commissioner for Information in Imo released a statement, and I don't think there's anything more to say about that. On the data collection, the Honorable Minister has already answered. I think the final question that I need to talk about is the COPS about safe burials. Now, the burial of a case of COVID-19 is not as risky as one of Lassa. So Lassa and Ebola, we know that when they pass away, the body fluids are very infectious. And so we advise on an elaborate process that is culturally very difficult for many parts of our country to avoid any contact with body fluids. We have, if you go on the COVID-19 website, you will see advisories on burials for COVID-19, but it doesn't have the same level of infectivity of Lassa or Ebola because it's not transmitted through body fluids. It's a viral infection transmitted through the respiratory tract. It doesn't die with the person. A virus survives for a while, but it doesn't. In Ebola and Lassa, it comes from if you sweat, if you touch the sweat, if you have contact with any body fluids. But for this, during burial, the most common one is fluids that come out from the body when an individual passes away, unfortunately. That is not the case for COVID-19, as far as we know at the moment. So we still advise on a fairly safe burial, but the risks are not as high, that's what I'm trying to say. The risks are not as high as when you are burying someone with Lassa or Ebola. Thank you.
Thank you. We'll now take the Minister of Interior followed by the Minister of Information.
Good day all. The personnel in the Nigeria Correctional Service manage facilities, the custodial facilities, with the highest level of efficiency and professionalism, such that I can tell you that yes, we have congestion in some of the urban custodial facilities. They are no longer prisons in Nigeria. We have custodial centers. And the congested ones are in the urban centers. Not all urban centers. They are in some of the urban centers where you have huge population of people. And understandably, those who have the cause to be detained are more than the facilities we have, particularly at the awaiting trial persons. So I can assure you that all efforts, all actions required to ensure that there is no occurrence or spread of COVID-19 in any of those custodial centers. I spoke about Kaduna yesterday. There was a mild disturbance in Kaduna yesterday, and it was put under control. It happened because the inmates in the condemned sections were anxious to know the outcome of our effort to decongest some of the centers, and they became agitated. It was put down without any casualty, and I want to believe that, having been handled, information has gone round the commands to, one, appraise the inmates of the efforts we are making to see that the approval given by the president is effected very, very soon. I must add that what we are trying to do cannot be done by us at the federal level alone. More than 80% of the inmates in the awaiting trial group are from the state. They are state offenders. So we are therefore working with the state government along with our own system to break down the profile, basis of incarceration, the term of detention, and several other factors to ensure that if at all people will be released, they will be released without jeopardizing the security of the nation. So we are therefore very careful and sensitive on the steps we take, even with the threat of COVID-19. And I must add this because it is important. The NJC has been of tremendous help. By the middle of last week, NJC issued a directive to all courts in Nigeria to suspend trial that could lead to any detention in the custodial service or centers. And we must equally commend the directive from the IGP, that is Inspector General of Police, to all police formations in the country to release offenders or suspects that are detained on minor offenses. And that will go a long way in ensuring that social distancing and reduction of detainees in those centers, so as to ensure that occurrence of COVID-19 infection and the spread will be eliminated, will be reduced, if not totally eliminated. That would be my own comment on your question. I thank you.
Honorable Minister of Information and Culture.
Thank you very much. I will just make three very brief interventions. In respect of the cable television, the NBC has already directed all cable TVs to allow local channels on their platforms to run freely, even if subscriptions have not been paid or renewed for this period. This is to keep Nigerians adequately informed. Let me make myself very clear. What it means actually is that if you subscribe to DSTV or Star Times and your subscription expires, you will still be able to see the local channels, NTA channels, TVC, AIT, etc., free of charge. While we were here too, I also received some inquiries about banks not opening all their branches in Abuja. I've conferred briefly with the national coordinator, and he says that all banks can open their branches all over the country from the exemptions we give. Also, I know that questions were also asked in respect of construction of roads. I got a text from the Honorable Minister of Works and Housing, apparently he's watching this program live, to inform Nigerians that the Federation of Construction Industries, they have written, has written to the Ministry of Works and Housing to suspend work until 20th of April, and the Honorable Minister of Works and Housing has approved. This is because construction work is also not helpful for social distancing, which is necessary, to contain the coronavirus. And also, construction of roads at times might mean going from one part of the state to the other, or one town to the other. So until 20th of April, there will be no resumption of construction works on our roads, all in deference to the directives of the PTF and Mr. President that we should do all we can do in our powers to contain the pandemic. Thank you.
Thank you very much. We will take the national coordinator, and thereafter the SGF will round up.
I think there were really three questions. The first one had to do with markets, and I'll try and merge most of the questions into one. So first of all, I just wanted to say that as the President's speech indicated, we're trying to achieve a balance here. We're trying to make sure that we get to epidemic control as fast as possible, while at the same time reducing the hardship to our people. Very few homes will be able to keep food and medicines for 2 weeks without going out. And that's why we've allowed the markets to operate. But there are conditions attached to opening the markets. So for instance, only stores and shops that sell food, pharmaceuticals, and essential items related to this will be allowed to operate. Secondly, they will need to observe social distancing measures. They will need to have measures clearly related to mass restriction in terms of mass gatherings. We've reduced the number of hours they can operate to only 4 hours. They are only allowed to open on alternate days, but it will be up to local authorities and the market associations to decide among themselves how they want to operate this. But the rules are pretty clear in terms of what we want. In terms of how they get to the markets, it's one of the reasons why we brought up the guidance, and we're appealing to our security agencies to please understand the difference between election restrictions and restrictions related to epidemic control. People will still need to get to their neighboring shops, they will need to get to their markets, but will need to observe all the rules attached to reducing the risk of acquiring these infections. In terms of water, if you probably look at my earlier speech, I did say that we expect people entering the markets to either wash their hands or to disinfect their hands. Washing is still a better method. If you're able to get hold of water, fine and good. But if you can't, we would expect that there will be a lot of hand disinfectants available for people to disinfect their hands. But certainly washing is the best thing to do. So I hope that is clear. The other question had to do with transparency in funds. Transparency is something that is very crucial and important at this time. The members of the Presidential Task Force do realize this. We will be very transparent in terms of the finances and the commodities that come to us. Having said that, though, I just wanted to make it very clear that there are actually two main channels that are currently operating. One is through the private sector initiative, the Coalition Against Coronavirus Disease. This is where most of the private sector will be able to pool their funds. These funds will not come to government, to make it very clear. And they will be providing logistics support, they will be providing commodities to us. And that's what we actually need more than anything else. The second channel in terms of funds is through the international NGOs and our multilateral partners. And here we have the UN system taking care of that. And again, that money will not come to the government. There's a separate CBN account that will be opened. That separate CBN account, I don't expect any significant funds to come into that account from externally. But in either case, we've already started sharing information on how commodities are distributed with the task force, and in the very near future, we will be putting this information up on our website. So transparency is something that we take very seriously, and we will make sure that the public continue to have confidence in us. The last one had to do with home remedies. Well, I'm afraid I'm going to disappoint a lot of people. There is no home remedy I'm aware of that can be used to treat or prevent coronavirus disease. Wash your hands, keep a safe distance. If you have respiratory symptoms, stay at home, avoid mass gatherings, and you will be free from corona. Thank you very much.
Thank you. We will now take the Secretary to Government of the Federation.
Thank you. Let me quickly try to see if I can answer all the questions that were asked. The first one had to do with restrictions regarding fertilizer as an agricultural product. I have received that report, particularly from the Port Harcourt axis, where we have one of the biggest plants, the Notori plant, with regards to the restrictions put in place. That's why the exemption further extended to port activities. In the President's broadcast, it was only Lagos port. Now we've included the ports in Port Harcourt and all other operations of movement of essential products. And in the protocol that was released by the national coordinator, farms, distribution of foods and perishables, manufacturing of foods, drugs, pharmaceutical, and essential products related to the response are all exempted. So that is adequately covered. All we need to do is to work with the subnational government in Port Harcourt to ensure that all trucks and tankers have a free flow, because it's not only trucks from the ports or from the factories. There is the issue of even tankers that are conveying petroleum products that are strapped in a very long gridlock of traffic in Port Harcourt area, but I believe that is being resolved as of now. And all these things will get to their destinations because they are equally essential. The month of April is the start of our cropping season in most parts of this country. So we must get the products out to those places. There was a question that had to do with cash being shared. That is part of the processes of the conditional cash transfers. And the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development is not here because she has started the implementation. If you remember, in Mr. President's speech, he had given instructions that that process commence immediately and they should be paid 2 months even in advance. So she's just complying with Mr. President's instruction, and that is part of the palliatives. Already they have a register of people that they have been dealing with under the social intervention program that was hitherto domiciled in the office of the Vice President. So it's a continuation of that particular program. The other question has to do with mass exodus. How you ask, how am I sure that these people that are leaving or that have left Abuja have not gone to their destinations with the COVID virus? Well, that's a $1 million question. I wouldn't be able to know because they have not subjected themselves to any form of examination to confirm whether they have the virus or not. And also, they have not shown, probably they have not shown any symptoms. But the truth about it, that's the essence of the lockdown, to allow for this mass movement. Because once we have this mass movement and people get into their communities, community transmission will start. And that is why the biggest problem would arise. Because people just disappear and they get into their communities carrying this virus and they begin to infest people in those communities. That was why government in its own wisdom first decided, realizing and conscious of the fact that this infection is not homegrown. We took the first step by shutting down our airspace so that we can restrict importation. You can see from what has happened in Osun that even importation by land border and land transportation is a major crisis. So we did that so that we can now deal with those that have been infected and have come into the country, to be able to track them, track their contacts, which is a major tax. I'm not sure. Dr. Chikwe, how many people are you tracking now? Close to about 5,000 people. As a result of the contacts of those that have been infected and confirmed. So you need to track those people that are already in their different communities or wherever they live, so that you can pull them out and quickly establish whether they are contaminated or infected or not. Because as long as they reside within their communities and begin to mingle with people, the infection will take a spiral of its own. And the mass community infection that we are trying to stop would explode in our faces. I believe, as part of your responsibilities as the advocates, you need to deepen that in the minds of our people, that this is not the time to travel anywhere, for your own good and for the good of the people that you are even going to. This is the time to stay put and make sure you keep yourself safe, healthy, for the best. How is the federal government handling COVID-19 immigrants in the country? They've already come in. I hope I got the question right. They have already come in. All we need to do is to make sure that we track them, whether there is a tracking method. I believe that the Center for Disease Control have put in place a system. That is why with the first index case, once it was established on which airline he came, the manifest of that airline was collected from the airline, and the Immigration Department too of the Ministry of Interior was asked to supply all the information that was required. And the tracing and the tracking of everybody on that flight began. It's a tedious process. Probably it was a flight that carried about 120 people or more. So you needed to track each and everybody to know their status. If they have manifested the symptoms or they are having some health challenges. So it's a very, very tedious process. They have come into the country. We have no other option but to try to trace them, track them. And I believe that you have, Dr. Chikwe, you have a device that can geolocate even the people. I know during the Ebola period, they had those devices, and I believe we still have those devices. That if we can have their telephone numbers, we can use that even to geolocate them and track them and be able to make sure that they are subjected to some basic investigation. And the fifth question has to do with the posture of the security agents. They are confrontational. Well, the citizens too are confrontational. It's a Nigerian phenomenon. Let's accept it. Most of you here have traveled the world in your work as journalists. Once you alight the aircraft in a country different from Nigeria, your attitude is different, your countenance is different, your posture is different, your language is different. After a week of sojourn and you return home, once the aircraft lands, boom, the Nigerian spirit comes upon us. So it's a Nigerian phenomenon. We will definitely need a paradigm shift in the way we approach each other, those in the places of responsibility and those that are supposed to be catered for. It's a big issue, and we need a total attitudinal change in that direction. The way we approach our policemen here would obviously not be the way you would approach a policeman on the street of London. And the attitude of the policeman on the street of London would definitely not be the attitude. I think there's something about us. And that is what is unique about Nigeria too. Don't misunderstand me. It's very unique about us. And we've used it to build a very strong nation. And a strong people, a resilient and a determined people. But sometimes we go above the cliff a little bit, and we need some moderation in the way we walk. And that is why I said yesterday, right now we are at the stage of persuasion, to persuade our people to understand that every restriction that has been put in place is first for their own good, and second, for the good of their loved ones, and third, for the health of our nation. And I believe if we can drive that and push that agenda, we will have a very good, harmonious working relationship between the people and the law enforcement agencies. I am not trying to excuse their excesses, but I am saying that we need to cooperate at this stage, because there is one disaster that is facing the entire people of Nigeria. And the only way we can get over it is if we work together in unison. Thank you.
was there a clear directive given to the security agencies? The federal government has proved that they should be defaulters. If not, should they be detained, should they be arrested? What's the directive to the security agencies?
Well, the protocol has been developed now. We are going to issue the protocol to them. We expect them to go by the protocol. Once the president had signed the quarantine declaration, it has the force of law. But like I said, at this stage, we want to be as persuasive as possible. The Honorable Minister for Interior wants to decongest his cells. This is not the right time to send more people into a place you want to decongest. So it's a matter of persuasion that as Nigerians, we need to work together to ensure that we get over this cliff as quickly as possible. So once the declaration was signed, it has the effect of law. But do we want to impose it with the use and instrumentality of the force of the law now, or do we want to persuade our people to have ownership of this process so that at the end of the day, we will cooperate and ensure that we limit the pandemic nature of this scourge? I hope I've answered the question. And this particular document and protocol will be made available to you, where all the exemptions are listed. If you read it in conjunction with the cessation declaration of movement within these places, you will have a complete picture. Yeah. Senior citizens, the conditional cash transfer and all the other palliatives that are being put in place has the senior citizens in the top bracket. Even the food that is going to be drawn from the strategic food grain reserve, the first criteria is to look at the poverty level and those that fall within that in a particular area. That is the basis of the calculation of the rations that will be issued to them. So it's a holistic package. If you look at the conditional cash transfer, they go to households of the aged people, not to young persons, because we have different programs for the young persons, Empower and the rest of it. But for the conditional cash transfer specifically, the beneficiaries of that are people who fall within the category of the aged and the elderly people in the community.
Thank you. We have taken all the responses to the first set of questions. We will just allow two more questions, two more follow-up questions before we close for today. I have received indications already.
Good afternoon, Chairman and members of the committee and colleagues. My name is Abbas Adibawale Jimo from Daily Trust. There are reports of some VIPs not cooperating with, and this question is for the Honorable Minister of Health, of some VIPs not cooperating with the relevant officials in testing or quarantine. So what is the committee doing about that? And the twin brother of this question was the Lagos State Commissioner of Health, declaring that he didn't know the whereabouts of the Chief of Staff to Mr. President, Mr. Bakari. If somebody who has a confirmed cases, his location is not known, how is the committee going to be handling similar circumstances? And what is the fate of those who are responsible for the Chief of Staff of others' treatment in secrets that are not known? Then, from my colleagues, they say I should commend the SGF and others who made their presentations available, apart from the question and answers. They implore that that should be kept, and other officials should make their own presentations available for documentation and proper reporting. Thank you very much.
Good afternoon, Honorable Ministers. My name is Juliana Taiwo Balonya of the Sun newspapers. This is from a citizen reacting to what the Minister of Foreign Affairs said yesterday about some of those we are looking up to for help are equally having challenges. So she wants to know, what are we doing as a nation to find a cure or a vaccine? Are researchers and scientists at work, or are we waiting for the rest of the solution to come from, for the world to bring the solution? 2, can we get indigenous manufacturers to produce test kits and ventilators based on prototype rather than waiting in line for relief? This is to the DG NCDC. Said at present 1,000 tests are done daily. Can we be availed of the test breakdown in relations to the labs available? What is the response time of NCDC to a potential case? And lastly, DG spoke about the discovery of infected patients on a vessel that arrived in Nigeria. However, MPA has continued to deny the arrival of this vessel with the people infected. Who do we believe? Can you clarify, please? Thank you.
Honorable Minister of Health.
At the time we in the Ministry of Health started to screen arrivals into the country from abroad, the passive cameras that we are screening and also the questionnaires, that was before the closure of our airports, of course. There were few cases of reports of some VIPs who trivialized what the Port Health authorities were doing, Port Health. And we got reports that some VIPs refused to have their temperature taken or to fill the forms. We informed the appropriate authorities at that time. That was in fact even before we saw the first case, because Nigeria was very quick in beginning to screen passengers who were entering the country. And the necessary order was given from above for the various VIPs to comply. So we got compliance from VIPs from then up till the airports were closed now. So the compliance of VIPs is presently, as far as that is concerned, not a factor. But having said that, I want to repeat that every person, including each of you here, you have a right to privacy. Each of you have a right to tell anybody whether you screened, or to tell anybody whether you are positive or negative. And that right is also granted to those who are in public office, the ones you call VIPs. They also have a right. Some VIPs have chosen to disclose by themselves. Some have authorized that their own result can be announced. And I announced mine. The SGF gave me permit to announce his. So, and the Vice President are also giving us permit. So those who didn't give permit, we don't announce their result, and we don't even tell you who is positive or who is negative. And we do not go into the fact of who is positive, then are they in treatment or not, because it's not part of what the public needs to know. But let me tell you that all those who are screened and they are positive, all of them, VIP or common man, are all in good care and custody and are being properly taken care of. With regard to the vaccine, I've said before that this is a new virus, and there's a lot of furious scientific research going on to learn more about its behavior, and about creating the vaccine for it. Very many laboratories are working on that in the United States. In Nigeria, what we have succeeded in doing is also at the Nigeria Institute of Medical Research in Lagos in determining the genetic sequence of this virus, which was a big feat. The first time it's been done in Africa. and confirmed to be identical with the genetic composition of the virus going on in Italy when the index case came in here. So that is a scientific feat. Some scientific laboratories are using that genetic sequencing in sort of a reverse way to generate antibodies that could take care of this disease. Our scientists here are looking within the limits of their capabilities, taking a deeper look at the coronavirus and seeing what they can learn from it and what they can contribute to the international body of knowledge about it. So the active participation, yes, is there. But even if you created a vaccine today, it has to undergo trials. It has to undergo clinical trials to make sure that it is safe to use, because a vaccine is not only to prevent you from contracting an illness, it's also to be sure that the vaccine itself doesn't turn out to be an illness. So it doesn't turn out to be something that harms you. So a lot of clinical trials must be done to ensure that it is safe and that it works. And scientific projection is that will take something like 1 year before you have something that you get a vaccine that works is one thing. For you to get approval, the approval of authorities in Nigeria here is NAFDAC, and in the United States is FDA. To get the approval, they prove that it actually does what it's supposed to do, and above all, proof that it does not do any harm. So those ones, all those tests will take about a year. So vaccines are probably a long way off. Right now, we have to still focus on our own social distancing, our own measures here, and other measures to fight this vaccine.
And just to add to the Honourable Minister's comment, I think the comment on the question on research came from a member of the public. I mean, any institute across the country that is interested can start research on these issues. It's not limited to government. Our role is to support the institutions, but most of the research coming out across the world is not being driven by government. So in terms of the question on testing, I said we were at about 500 tests per day right now, and are working towards getting to 1,000 tests per day by next week. This is still the trajectory. Like I announced, we've just included Abakaliki over the last couple of days, and a series of other labs like we announced yesterday that will be included over the next few days. So we're constantly increasing that. We cannot announce number of tests done every single day, but we will include it in a weekly update. So at the end of the week, we'll try and collate the number of tests done. These tests are being done across many labs. The more we add labs, the more complex it is to get this data, because remember, we not only test for new cases. Every single case is tested severally when they become ill until they clear the virus. So if you are tested positive today, you will be tested on day 3, on day 6, and subsequently. So for a lab, we have to disentangle all of that. So it's not something we can update on every single day as we give our new numbers. But what we will do is put it together weekly and share it with members of the public, so you know how many tests we're carrying out and what proportion of those tests among new people are positive. And so it's an important distinction. It's not just the number of tests, that just measures volume. It's the number of tests carried out among people that meet the case definition to be tested. Thank you.
Thank you very much. With the response from the DG and CDC, we have come to the end of today's briefing. We want to thank our partner stations and the online group, as well as the print media, for supporting this national cause. Thank you very much. We'll see you tomorrow at 2 p.m.